G'day, how you going?
This patient was being treated for acute lower back pain, and you can see me here utilising the McKenzie Method, which is an excellent modality for removing derangement within the tissues of the lumbar spine. I'm supporting his pelvis while he does the familiar lazy push-ups. I've cued him to tuck his elbows into his sides so that he's using the tricep muscles only to elevate his chest up off the bench. A good cue for patients to do this is to make like a sphinx or a cobra. And it should be relatively painless, at the most a comfortable discomfort. I'll then follow it up with some pelvic wiggling. It's nice for the patient just to be pushed around gently like this to help loosen the tissues a little bit before I attempt to adjust them. Prior to treating this patient, I did a quick assessment of him and noticed when standing from behind, he was quite clearly listing to one side, which means his shoulders weren't exactly lining up on top of his pelvis. There was almost a slight dogleg through his spine. I then had him attempt to bend forward and touch his toes, which he couldn't due to pain and restriction. One of the techniques I use is active release technique, and this is a great curtain raiser to adjusting a patient, especially in this condition. You can see me working through the piriformis muscle here, using my leg and my hands to squeeze a little bit more room out of his lower back and glutes. Patients who are suffering acute lower back pain, you have to be very careful with if you attempt to adjust them. The force applied through the lumbar spine in somebody who's quite ginger due to pain can be too much for some people. So I'll always preface the adjustment with doing some soft tissue work or mobilization of some sort. And if I feel that they're up for getting adjusted and I can do it without incurring any more pain, then I'll do so, but only if I perceive the benefits to outweigh the risks. And then I set him up for the adjustment.
Breathe in.
Just taking care not to overly rotate him too much through his spine.
Okay.
This patient obviously required follow-up treatment, but upon testing at the end of the consult, I was happy that he could at least bend further forward than he could originally.
Thanks for watching.
Please subscribe to my YouTube channel.
Yeah, thanks mate. Good on you.